The healthcare system in Canada is becoming an actual joke, and it's getting worse and worse. I remember when I was a kid having issues going to the emergency room, waiting for hours and hours and hours with literally a bent finger. It looked like a Z. I tripped and fell and landed almost all my weight in my pinky, and I was in the emergency for hours and hours and hours, and it was brutal. It was excruciating. I was a little kid with a broken finger. It really hurts. I also broke my hand before as well, and that was another issue where I had to wait for a ridiculous amount of time. And this is from this is an era that's well past. This is like over a decade and a half, 2 decades ago, actually, I would say, probably over 2 decades ago. Canada now has a much worse housing crisis. The population has almost, well, I don't want to say doubled. It was about 29 million, 30 million back when I was a kid. Now it's 40 million, so it's went up by 25%. And have we built have the cities gotten any better? Have we expanded? Have we built more towns, cities? Have we built more housing to accommodate all these people? No. Have we built more hospitals? Not really. So, yeah, that's what we're dealing with right now in Canada, and it's causing a massive crisis on our hands.
I've been to 3 different walk-in clinics trying to figure out what's going on with my back. Each one of them is either closed for the day or says I have to make an appointment. What is the point of having a walk-in clinic that you need to make an appointment at? Like, something needs to change in this country and the medical, because this is ridiculous. I am tired. I'm so tired of this. Man, I wish there was a paid option. I really do. I'm not saying I don't appreciate the ability to be able to go to the hospital, but when it comes to everyday matters, I wish there was a paid option so I could just see somebody and get diagnosed and get shit done, because the longer this goes on, see, it's like a spasm that I keep getting, and these like electric pains, like, oh my God.
Yeah, so that is one of the downfalls of having free healthcare, is that, when things get busy and you just want something done quickly, there's no paid option. I know in Brazil, where my wife is from, there's public and there's private. It's kind of like half and half there. I'm wondering if Canada could kind of do something like that, make it a little easier for people who really want to get stuff done right away and pay if they have the money to pay for it. But ridiculous, just unbelievable. This reminds me, the family doctor thing. So when we moved to Calgary, before that we were looking for a family doctor when we were in Toronto for like the last 7 months or so when we were in Toronto, and we never got anything. So after a year of being in Calgary, we finally had a call from Toronto being like, hey, we got you a family doctor. Almost 2 years later, not even making that up, almost 2 years later, we finally get that call. And we're like, yeah, we're in another province, so all good, see ya. Ridiculous.
I'm accepting new patients.
We're in a wait list.
Can I?
Wait list for that patient.
How long is the wait list?
6 months.
It's
Do you even feel it's just for yourself?
for me, my mom, and my sister, because our family doctor ditched us. She just went back to Australia.
Oh.
And they didn't tell us. I called to book an appointment by coincidence. And then they're like, oh, she's not even here. I'm like, what do you mean? They're like, you gotta look for a new family doctor. This is not funny, but it's funny.
God, yeah, you gotta look for a new family doctor. Yeah, that's kind of what we did as well when we went to Calgary. And it actually didn't take too long. I think we found a family doctor within 2 months. However, the family doctor we're at, every time we go there, it's insanely busy, and I feel so bad for the clinic there because the amount of people they have for a small practice, I can't believe it. I remember going to a family doctor when I was a kid, and the waiting room never had more than 4 or 5 people in it. This thing, it's a small waiting room, and I swear it's packed with at least 25 people every time we're there. And regardless of the time of our appointment, we always have to be there at least an hour or 2 hours more than we actually have to. So it's almost like a day thing now. It's not like, go there for an hour. It's like, no, this is going to be at least half a day.
Canadian healthcare is so funny to me because I recently went to the dermatologist office. Obviously, it took me 6 to 8 months to get the earliest appointment. So by the time I sat down, the dermatologist was like, oh, it doesn't look like you have any issues. And I'm like, yes, because in the last 6 to 8 months that I've been waiting for this appointment, I basically healed myself. And he was like, oh, that's great, but just in case, I'm gonna write you a prescription anyways, just in case your skin flares up again. Cliff has really bad allergies. His symptoms are especially bad in the summer when there's a lot of pollen. Sometimes it gets so bad that it's hard for him to breathe, which is a huge problem. And he would call the doctor and they would be like, okay, yeah, that is really bad. Let me refer you to an allergist. And of course, the earliest appointment is 6 to 8 months in the future. By the time he goes to the allergist, it's wintertime and his symptoms aren't as bad anymore. The allergist would be like, oh, it doesn't look like your symptoms are that bad. I need to see really bad symptoms so that I can treat you properly. While I'm grateful that we do have free healthcare, I guess what I'm trying to say is you really get what you pay for or what you don't pay for.
Yeah, and those are specialist doctors too, like dermatologists, allergists, and these are places that you can go to if you're in the States or even Brazil. You can pay straight up to go and see these doctors because they are specialists, right? And free healthcare usually only pays for the basics, so when you want a specialist, it's very difficult on you living here in Canada. So just keep that in mind. Keep that in mind if you're planning on making a move or anything like that.
All of this, something has to change. And don't tell me there's no money for it, because there is. We pay for it. Let's talk about the approximate 13% of Canada's GDP that goes towards healthcare. That's about $300 billion annually. What are the subsections of healthcare that are the main focus of this expenditure? I'll tell you what's not. It certainly isn't staffing, as we know how severely understaffed hospitals and clinics are. Remember those wild ER and referral wait times I was talking about, or the lack of overnight emerge doc, or the shortage of family doctors? When people aren't compensated fairly, they don't show up the way that they're supposed to, both literally and figuratively. In terms of the latter, those that do physically show up are often overworked and frustrated at their circumstances. And all of this creates the perfect storm of long wait times, most urgently for those in need of critical life-saving care.
None of that is a surprise. None of that is a surprise. Yeah, it's unbelievable. The wait times for people, if you're sick, a lot of people waiting for like cancer treatment end up passing away waiting for something, just for a procedure. It's just unbelievable what's happening here in Canada. Healthcare system is an absolute joke. Let me know your thoughts about it. Do you have any personal experience dealing with, or do you have any issues that you've had in the past that you've had to wait for, or you've had like someone say that you have like 7 months to get your next appointment, which is insane. 7 months for something. One woman healed on the way to the appointment. She had 8 months to heal herself and said, well, you don't even, yeah, you're fine. Well, thanks for coming anyways. I guess I didn't have to do my job. That's kind of the way we get it. That's what we get here in Canada right now. So anyways, let me know your thoughts about this video down below in the comment section, and I will see you guys in the next video. Take care.